I have a patient coming in before and tell me that is it because the person is so lazy that the eyes also become lazy? Hi guys, Ben here from Vitrocraft Optometrists. How are you guys doing? So today we will be talking about a topic that is related to a child's eye condition, which is known as amblyopia, or also commonly known as lazy eyes. So what exactly is lazy eyes? How did it happen? And what can we do to prevent it? Very frequently, we will have parents bringing in their children and then ask us to check if their eyes has a lazy eye. They are concerned, right? Oh, I'm not sure whether if my child has lazy eyes or not. And there are also some cases where, adults or even teenagers that comes in and they tell us, hey, I'm told that I have lazy eyes by my previous shop. Or I was told since young I have lazy eye. And very frequently when we do our examination, we found that actually the person does not actually have lazy eyes. So why is there so much confusion about lazy eye? What is actually lazy eye and what is not? So today we will be sharing with you guys what actually is lazy eye and what are the common things that people confuse lazy eyes for. So the number one eye condition that people always confuse with lazy eyes is called Strabismus, also known as squint. 都怀疑是叫斗鸡眼啊，或者是斜视。So Strabismus is a misalignment of the eye, whereby the eye alignment is not straight. It might go in, one side might go in, one side might go out. It depends. So both going in or out is also considered as squint or strabismus. Having squint doesn't mean you have lazy eye. Alright, so a lot of people confused about this. I'm not sure, my child's eyes appears to be like going in a little bit. I'm afraid that he has lazy eye. So actually no, squint and lazy eye is not the same, but they might be related. Untreated strabismus can cause lazy eye, or untreated lazy eye can also cause squint. It doesn't mean that you have squint, that means you 100% have lazy eye, or it doesn't mean that you have lazy eye, 100% you will have squint. So it's different, right? Another condition that people always confuse and think that it's lazy eye is called Anisometropia. So Anisometropia is actually the difference, the refractive power difference between two eyes is very big. So for example, one eye you might have -1 diopter short-sightedness. On the left eye you might have -5 diopter short-sightedness. So there's a difference of -4 diopter. A lot of people will confuse this as lazy eye. They think that, oh, I have one eye -1, one eye -5, so I think the -5 one is my weaker eye, it is the lazy eye. So actually it's not like that, right? So again, Anisometropia, if left untreated, might cause lazy eye, but it's not lazy eye, it's different, okay? It's a two separate condition lah. But that is the reason why people kind of get confused. So it doesn't mean that if you have Anisometropia, you will have lazy eye lor. What actually is lazy eye leh? It's not Anisometropia, it's also not strabismus or squint. Then what actually is lazy eye? So lazy eye or amblyopia is actually a type of vision problem whereby there is a breakdown in the pathway between the eye and the brain. That means the eye and the brain, there is a pathway for them to communicate. Or so you can think of it as a highway lah, right? So the eye will see the image and then it will transmit the image, the information to the brain. So using that pathway or that highway lah, or if the highway break down, that means the information cannot pass. So vision is not clear, right? They cannot transmit, the eye cannot transmit information to the brain. Okay, so amblyopia or lazy eye is the breakdown of this part of the visual system. So if let's say there is a breakdown happening in one eye and there's no breakdown in the other eye, one eye will become blur, one eye is clear, right? And then in time, the brain will favor the clearer eye. So it becomes, it kind of ignores the other weaker eye, the one that have a breakdown. And it usually happens when the person is young, right? Small children. And lazy eye can only be corrected if we detect it at an early age. If we detect it after age of 9, the outcome is usually poor, not good. Why this breakdown of this pathway occurs is usually the vision, is not clear. That means there is poor vision. So the main cause of poor vision is uncorrected refractive error, okay? And this accounts to the majority of the reason why people get lazy eye. That means if you have short-sighted or long-sighted or astigmatism at a very early age and you don't get detected and it doesn't get detected, right, it might develop into lazy eyes. So it's very important for us to detect as early as possible and correct as early as possible because the child requires clear vision for that nerve pathway to develop. Okay, so in a study, right, in a Malaysian research actually conducted in 2018, they found that the prevalence of amblyopia in preschool children is 7.53%. Okay, which is quite alarming, right? And then out of this 7.53%, 66% have bilateral amblyopia. That means both eyes are affected. That means both eyes, the nerve pathway is, that means it's not well developed. So this actually tells us, highlights that this problem is quite severe, right? And it needs to be addressed. We need to detect early. And how to detect early is we need parents to be aware of this kind of situation is happening and bring them for a preschool eye examination. So why preschool examination is very important is because first we want to try and detect if there's any uncorrected vision, whether or not the child's vision is clear enough because a lot of the learning comes from visual. So if let's say vision is not good, it affects their learning abilities. So we want to make sure that the vision is good. Second is we want to detect if there's underlying problems such as amblyopia or lazy eye, if there's squint, and other even more sight-threatening problems, right? So in case you guys don't know, right, amblyopia is it can cause permanent reduction in vision. That means your vision can be permanently reduced. So after age of 9, if let's say we detect and vision is reduced, no matter what power we give, vision cannot improve. So this is quite sad, okay? And we can only treat amblyopia if we treat it before age of 9, right? So if let's say you bring your child for a preschool eye examination, what is there to expect? Okay, so let me just share this with you guys. During an eye examination, the preschool eye examination, I think you should do it at least once before the child going into primary 1. The optometrist will assess, and if let's say the optometrist found that the child has lazy eye or amblyopia, the first step we do is we correct any underlying uncorrected refractive error. Wow, sounds complicated, but actually it means that if let's say the child has any short sight, astigmatism or long sight, we will correct it with correction. So a mode of correction, it depends. Usually it's glasses for young children, but it can also be contact lenses. So after giving full correction, we will usually insist on full-time wear because clear vision is required for the nerve pathway to develop. So if let's say vision is not clear, or if you don't wear full-time, your vision is not clear all the time, so the pathway might not develop very well. And we usually put the child on 1 to 3 months of follow-up to monitor the visual acuity. Okay, so for most cases, 1 to 3 months with full-time correction, if compliance is good, usually the vision will improve. So if let's say the vision is improved back to a normal state, that means your job is done, our job is done. There's no need for further procedures. If let's say vision is still not good, so usually we'll start a procedure called a patching therapy. Okay, so patching therapy, it involves using an eye patch to patch the child's good eye, the non-amblyopic eye. So the reason for us to do so is to force the child to use the poorer eye and try to stimulate it. But of course with correction, right? We need to give full correction and then patch the good eye, force them to use the poorer eye. And then when they do the patching, it's just not patch and then run around, do nothing, right? So we need to patch and then we prescribe some visual activities such as coloring, something that is visually intensive for them. Okay, so after that, we'll put them on monitor as well. So this process, this patching process, I can tell you from our experience is very stressful for both parents and children. So the children, for one, they will hate it because you are forcing them to look at things blurry. And then parents will struggle to get their child to patch and do the visual activity. So it's sometimes quite challenging for both parents and children. So close monitoring is required because we don't want to overpatch, because overpatching can cause a reversal. So if let's say this eye is the lazy eye, if you patch too much, it might cause a reversal. So we need to be very careful. So you need to work very well with your optometrist. Our goal is to enable the child to get good visual acuity or normal visual acuity, which is usually 6/6 in both eyes and equal acuity in both eyes. So if let's say the eyes can, one eye, the good eye is 6/6, we will try to train so that the other eye can go back to 6/6. So when the child achieves 6/6 vision, and then so the problem is solved. So again, this patching therapy can only be effective when it's detected early. So it's very important to bring your child for eye examination so that we can detect, if anything, we can detect in the earliest stage possible. So from here, we can see lazy eye patching therapy is actually quite challenging for both parents and children. And we usually don't want to go there if, let's say, if possible, right? We don't want to go there because we also understand it's very tedious and the child don't like it. And the parents also, you need to monitor, get them to do these kind of things. It's very difficult. So that's why it's very important. I need to stress again, bring your child for preschool eye examination. Make sure we detect early so at least we have some time and try to, detect if let's say there's any amblyopia, we can treat it before it's too late. So this is it for this time. If let's say you find that this video is very informative, please give us a like and share, or you can subscribe to our channel or our Facebook page. So if let's say you have friends who are young parents who have young children at home, and you think that this video, this information might benefit them, please do share with them as well, because together with the more awareness, we can, reduce the incidence of amblyopia. So that's all for this video. Until the next time, see you guys. Bye-bye.